I'm Brittany Ward, and I'm one of the co-CEOs at Memorial Community Hospital. I'm here with three other board members of our hospital, and I'll let them introduce themselves.
I'm Hannah Harad, head of the Human Resource Department.
I'm Hannah McKenzie. I'm the Chief Financial Officer.
I'm Avery Carter, the co-CEO.
So, at Memorial Community Hospital, we're located in a small rural area. Our population is only about 6,000 people. With that being said, one of our main values at MCH is family-centered care. We know that many members in our community don't have a lot of options or availability to get far places to receive health care, so that's why we strive to make MCH such a high-quality, patient-centered care destination. With our mission at MCH, we're really passionate about providing our community with wellness promotion. We want to give them the tools to really have great health on their own and to be educated in what they can do to live healthy lifestyles. We're very passionate about increasing our patient understanding, and health literacy is a big part of what we do. We want to strive to equip our patients with the availability to understand the information they're receiving. And we also are very passionate about providing affordable care. As we know, many members in our community are from small towns. We want to make sure that their care is affordable.
Now, our vision here at MCH is that we will be a leading institute that teaches our patients how to better their health by taking the time to perfect our own patient-centered care. So this means that we are really focused on preventative care, and we are really focused on families, and we're very family orientated. So this means that we never put profit over our patients. Our patients are solely the number one thing that we care the most about. And also as a result, we strive to provide the highest quality care that we possibly can.
So the main reason that we're here today is to talk to you guys about how we think our hospital will benefit from state funding. Over the years, we've had to come up with significant decreases in our budget. A lot of those included cutting some supplies, employee benefits, advertising, travel, and training. Obviously, cutting supplies causes us to not be able to give patients the best care possible. We just don't have the resources for it, and that's where funding can help. It can help us give us more resources to help for certain illnesses that patients have. Employee benefits also, it causes the employees to not be as motivated to work. It causes our turnover rates to increase and have employees not stay with us for as long as we'd like. Advertising, we are in a rural town, so advertising is very important to us. It gets our name out there, gets people to know where to go to get the best care. Travel and training, we would love to send our employees out to get the proper training that they need, but with our cut in budget, we just don't have the room for that. And that being said, we feel our physicians might not have as well training as they could, giving our patients the best care that they can get. Another thing we had to do was cut the ophthalmology department from our hospital, and that was a huge deal because that cut a bunch of jobs from our hospital. So a lot of people are without work and without pay, and since we are such a family-oriented hospital, that is a huge deal to us, knowing that we had to cut jobs from people. That being said as well, now patients don't have that source of care, and being in such a rural area, they may not go further away to get the care that they need now that they don't have it here. So those are just a couple examples of where we have had to cut in our budget and how state funding would help a lot for us.
At MCH, we ensure protection of not only our patients, but our employees. And by doing so, we implemented a very strict vaccination policy. Currently, we require vaccines for measles, the flu, and whooping cough. We require documentation being provided to HR immediately upon being employed with the hospital. Ample opportunity will be given to employees for receiving these vaccinations, but also in a timely manner will be required. And ultimately, failure to comply will result in immediate suspension, because at MCH, we really, really require that the protection of patients and employees is of the utmost priority.
Another thing that we value is that we went paperless to also save money. That's one way that we have made our budget work. And also with the vaccines, we value the vaccines because it's gonna keep both the employees and the patients healthy, and so that's another area where we won't have to use resources if like someone with that sickness were to come in. And being such a family-centered hospital and such a family-valuing hospital, we think that these budget cuts will greatly impact the employees. So this is why we think the state funding would benefit us greatly, because it shouldn't matter where we are in the country, where we are in such a rural area. I think that the patients here need to get the same amount of care.
So please support us and our mission to help our community around us.
At MCH, we want everyone to be able to receive the proper care, and their location should not determine their quality of care. So we would really appreciate your support in helping fund our great hospital.
Thank you for your time.